is cervical stenosis and is there hopes to treat it? That's the subject of this video. Hi, I'm Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Stay tuned. All right, let's talk about cervical stenosis. This is actually not a human being's vertebra, but it's nice and big, and it shows what I want you to see. So this is the front of the vertebra, and this is the pointy part. As you touch the back of your neck, those bumps that you feel are this. Of course, in human beings, it's not pointing downward, but that's beside the point. So if you have a series of these sitting on top of each other, like in the human spine, right there, and I'm gonna bring it a little bit closer, and I'm gonna actually show you something lower, but you have the same setup in the neck area. So between the two vertebrae, like that one vertebra I showed you, there is a hole where the nerve, these yellow things are the nerves that come out. So now I'm gonna use my hands to show you this. A lot of times people don't really understand the actual terminology. So if that's the hole where that yellow nerve was coming out of, this nerve was coming out of, that hole can start getting smaller. Some people don't have it nice and big to begin with, and inside of this hole, there's soft tissue that can actually get thicker as a result of misuse. Misuse is when you're carrying your body, but not in a functional way. So certain ligaments inside this hole become thicker. If the ligaments inside become thicker and already smaller, on the smaller end of the size of a vertebra of the hole becomes even smaller. So you can add more and more things into the reasons why the size of this hole changes, and there's an encroachment, meaning there's, like, for lack of a better word, imagine an invasion into that space where the nerve exits through. Now, what cervical stenosis is? Stenosis means basically narrowing of that hole. That stenosis can be where the nerve comes out, or it can be where the actual cord goes through. So in the center of the two vertebrae, there's a hole where the spinal cord goes through, and in between two of these, there's a set of nerves that come out. Where's that? There. Those yellow lines that I showed you, that's coming, exiting the spine. So those holes can have narrowing for one reason or another, and encroach or cause irritation of the nerve, and not necessarily an impingement. Most of the times, it starts with an irritation, subtle signs and symptoms, which there are other conditions that can actually mimic those signs and symptoms. For example, trigger points can shoot pain down your arm, and you thinking, oh, it's a nerve pain, when in reality it doesn't have to be. In fact, most of the times, what is considered as a nerve impingement is really not even that. But back to the cervical stenosis, some of the signs and symptoms are irritation of those nerves with specific movements. So let's say you turn your head to the right, and that's when you feel symptoms going down, vague, but it doesn't have to be like shooting out, electric shock. It doesn't have to be to that extreme. Is there hope in treating that? The answer is absolutely yes. And here's the smart aleck answer to this very important question. If something makes that tendon, or those ligaments, not tendon, the ligaments in those holes I just explained to you become thicker, we're not going to go and scrape up the thickened ligament. What we need to do is take away the reason why they got thick to begin with. We don't go and start behaving like, okay, I need to put a brace and not touch it. In fact, that does a lot more damage. Massage is not going to help it because it's too much on the surface. The issue with stenosis due to lack of function is much deeper than that. The way to treat it effectively is not to necessarily get adjusted. Adjustment is stimulating the nervous system. It's a beautiful thing. That's kind of jump starting the machine that pushes you towards health. But that doesn't do the job by itself. You may isolate the area and start doing physical therapy. Well, geez, if the area is not functionally behaving, why am I doing exercises to something that is not even where it needs to be? The answer is functional rehab and postural neurology. They go hand in hand. I don't want to make this video into postural neurology and functional movement. That's a whole different videos. In fact, I've done videos on that. I invite you to visit my YouTube channel and look for those. But this is the true answer to cervical stenosis. You're not stuck with it. You don't need to look at it as, oh, I need to have surgery. You don't need to waste your time trying things that will not get you to the point of functionality. If you enjoy what you just saw, I invite you to subscribe to my YouTube channel, check out my website to better understand the true answer to functional or dysfunctional movements, which is what we're suffering from as a result of our sedentary lifestyle, sitting behind a computer. And for some of us, not me, some of you who are much younger, from the moment you've opened your eyes and you were able to do anything with your hands, you've started playing videos, watching TV, playing computers, so you have totally redesigned your nervous system when it comes to movement and what you're dealing with as a result of that. Anyway, thank you for watching, and until next time, take care.